So go to like the page for electrolyte. I'm sorry. 170.
Yeah, lab values. BBGs.
Electrolyte, sir, 179 is schizophrenia. I was like, what? Depression.
No, 170. 170.
170.
Yeah.
170. Yeah. So this is not enough though. This is not the right one. Although this is important, but what I wanted to say is because they're not gonna ask you the range. It's really useless to remember the range. You wanna know why? Because they do exams, especially your exit. They don't ask you about the range anymore. Because on your test, they already give you the range. What they're gonna ask you is interpretation about it. Like let's say, for example, right, on your test, when you see it on the 22nd, they're already going to tell you that the normal BUN is 10 to 20. But what they're going to ask you is, based on the patient's lab result of, let's say, 23, what does the nurse expect from this lab value? So they already tell you the range, but they want you to know, what do you think, or how would you interpret if the patient's BUN is 23? What does that tell you about the patient?
Kidney impaired.
The patient could be dehydrated. The patient could possibly have a what? Kidney issue,
Yeah.
right? Also, when it comes to labs, and you really want to determine kidney function, the most accurate is creatinine, right? Not BUN, right? So again, they're going to do that. They're going to give you the normal value of blood creatinine. What's the normal value of blood creatinine? Blood creatinine for kidney function.
90 to 139.
0.6 to 1.2. Alright? Alright, so that's the normal. They're already going to tell you that. 0.6 to 1.2, they're already going to tell you that that's the normal value. But what they're going to tell you is, if the patient's value is 1.9, what does it tell you about it? The patient could be dehydrated, or a more serious one, the patient could probably have what? Kidney problem. They could probably have kidney damage. That's why their blood creatinine is so high. Right? And that's why, creatinine and BUN comes together if you want to determine kidney function, because when it comes to a patient that has kidney damage, both BUN and creatinine actually what? Goes up. Okay? So, again, don't pay too much attention in remembering the normal range, because most of the time, like I said, they're already going to give you the normal range. It's the interpretation of the value that you need. Okay, so that's it. Let's take a look at this. Those were the wrong pages. Electrolyte 79. That's right. That is the right one. 79. Alright, so here it is. Okay, fluids and electrolytes. So, very, very important. This one is very important because there are going to be several questions on this chapter on your exit. For one thing, one of the things they're going to ask you on the exit on the 22nd related to this chapter is that they're going to ask you signs and symptoms of fluid deficit and fluid overload. Right? So you want to make sure to start going over on the signs and symptoms or manifestations of whether they have fluid overload or dehydration. They're going to ask you that. Right? So take note, make sure that you're studying the signs and symptoms. Although we'll discuss it also as we go on with our lecture. The other one they're going to ask you here is this, page 81. The electrolytes. Right? The electrolytes. They're going to ask you the different manifestations. So, let's say, for example, the three that they always ask on electrolyte is potassium, sodium, and calcium. Those three are the three most often that they ask about on electrolytes. So, let's say, for example, the normal value of potassium is what? 3.5 to 5, right? You all know that. When they give you that in the exam, what they're going to ask you is, here's the value, right? So, let's say the value is 5.5. Based on the normal value that they gave you, you know the patient is what? Hyperkalemia, right? So take note. You've got to know the terms, right? Because sometimes you don't use the word potassium, but you'll use the word kalemia. So you need to know what does hyperkalemia mean. Hyperkalemia means elevated potassium. Hypokalemia means low potassium, right? And then for sodium, the term is natremia, right? And then for calcium, the term is calcemia, right? So what they're going to ask you is signs and symptoms. It's already here on this page. They're going to ask you identify the manifestation of hypo or hyperkalemia, hypo or hypernatremia, hypo or hypercalcemia. So those three, focus on those three. Because those three are the main ones, okay, that they actually ask when it comes to electrolytes. Right, so focus on those three. Try to remember as much as you can the different manifestations of the hyper and hypo for kalemia, natremia, and calcemia. Right? Because that's what they're going to ask. That's what they focus on electrolytes. Okay? The other one that's important here is the acid-base balance, ABG. We're gonna lecture on this, and I'm going to teach you the best and easiest way to break down ABG, so that it will be easy for you when you're given an ABG question. But also try to make sure you're studying ABG. Right now, take note. There are three areas of the ABG that you really want to remember. There are three areas. You want to make sure you know the pH. Okay? pH is very important because it is through the pH that you're able to determine whether the condition is alkalosis or acidosis, right? That's the only way. You're really going to determine it based on the blood pH. Other than the pH, also make sure you remember the CO2, okay, carbon dioxide. And last but not the least, the bicarb. Okay, because as long as you know those three, pH, CO2, and bicarb or the bicarbonate, that's all that you need to know, and you will be able to easily determine ABGs. It's going to be very easy for you already to determine the answer on ABGs. Okay, so focus on those three, and then once we get to the ABG, you will see how helpful it will be just knowing those three and finding the right answer for ABG acid-base balance. Okay, right? Now, other than that, a few things also that you need to look for in your book. The normal value for white blood cells,
5 to 10.
red blood cells, and hemoglobin. So let's say, for example, white blood cell, the normal is 5 to 10,000, right? Because they're going to ask you on interpretation also value is that. Let's give an example. They're going to ask you, based on the patient having a diagnosis of MRSA infection, what would be an expected lab value by the nurse that would be elevated? White blood cells, right? So that's an example of how they'll ask you that. They'll ask you, how do you apply the value of white blood cells to determine whether the patient has an infection? Now, other than white blood cell as a possible sign of infection, don't forget there's another one which is the I'm sorry,
Yep.
leukocytes. That's part of the white blood cells, right? But then the other one is
Temperature.
ESR,
Oh, yes, sir.
erythrocyte
Sedimentation
sedimentation rates. So just remember that term because that's also another lab we can determine if the patient has some in general though, right? It doesn't really say exactly if you have an infection, but it does tell you whether there might be an infection based on the ESR or the erythrocyte sedimentation rates. Just put that in.
Ito nasa yung mga white blood cell. Infection.
Or in short, ESR. Alright? So yeah, so don't forget that. That's another one that's important. Another one for labs is your ALT and AST. Who knows the application of that's for liver. Very good. Don't forget that. They're going to ask you that. One of the things they ask is how do you determine patient's condition based on their liver status? So go ahead and already know. What the answer to look for? AST and ALT. Alright, the other one that you also have to remember is amylase and lipase. Alright? So what is amylase and lipase for? For what specific organ?
Pancreas.
The pancreas. Very good. Don't forget that. That's another one that they will ask. Pancreas. And then once we go to pharmacology, there are other lab tests that we will discuss specifically with vaccination factors, right? Thrombocytopenia, that's another one. Who knows the term thrombocytopenia? This is important. I gave this as a list for you guys to study weeks ago. You guys study that list of terms. Remember, if you don't know the terms, you won't be able to answer the question. Why? You don't even know what they're asking for. Right? Okay, so what does thrombocytopenia mean? No platelets. Very good. Alright? There are, I think, maybe 2 or 3 questions related to this on the exit. Thrombocytopenia. What does it mean?
Low platelets.
Low platelet. So the normal platelet is 150,000 to 400,000. Right? So if it's lower than 150, it can be thrombocytopenic, which means the patient is at risk for
Bleeding.
Okay? Don't forget that, sir. Another term that they put there related to what I understand about the WBC is right? I put that there also. It says make sure you learn this term because they'll ask you this. Now neutropenia means low
White blood vessels.
So that means the patient is at risk for
Infection.
And then we'll go over them one by one. So those things. Okay, any questions so far? Yeah, our time is going by really fast. Question? Alright, for the NGN, what are the NGNs you're gonna see? There are 8 major NGN that's gonna go over the entire clinical judgment. Like I said, the NGN is about 80 to 90 points of your test. So there are 8 major NGNs that they're going to ask you. Number 1, right, is your tuberculosis. You can have an 18 question on tuberculosis. Okay? So, does everyone know the clinical judgment model? Who knows the clinical judgment model? It's something that I gave you guys months ago. Yeah, a few months ago. Oh. Yeah, I know. Not a problem. So why do I want to mention about the clinical judgment model? Alright, why? Here it is. That's the clinical judgment model. So why do I want you guys to make sure you remember this? Because this is the sequence of how they're going to ask you questions on the NGN. It will go like this, one by one. You know how it comes out as a case study? They're going to do that. It's going to come out as a case study, and they're going to ask you on this sequence right here. On this specific sequence. So one of the ones that will have this cascade here of 6 areas, like I said, tuberculosis. Okay? Tuberculosis, right? That's one of it. The other one, blood transfusion, is going to be there. Okay, so we're going to discuss about blood transfusion, but that is one of the things that will be right here. So we'll have this cascade also, blood transfusion. Okay. The other one, rheumatoid arthritis. Okay, rheumatoid. Right, so we have tuberculosis, blood transfusion, rheumatoid arthritis, okay? Alright, the fourth one, ulcerative colitis. So there's actually 2 of them that might come out, depending on the version of the exit that you will take. There's 2 types of inflammatory bowel disease. One of the version has ulcerative colitis. The other version has Crohn's. So you need to know both. Inflammatory bowel disease. So ulcerative colitis and Crohn's. Right? So ulcerative colitis and Crohn's. The 6th one is thyroid disorder, primarily hypothyroidism or Hashimoto's thyroiditis. Okay. Hypothyroidism. Hypo is Hashimoto's. That's the other name. Yeah, so remember, like Graves' disease is hyperthyroidism. Hashimoto's is hypo. Hypothyroid. Okay, that's the other name for hypothyroidism. Hashimoto's thyroiditis. Remember, the other name of hyperthyroidism is
Graves' disease.
Okay. Diabetes, primarily gestational diabetes, might come out also. That's the 7th. Okay. Gestational. That's number 7. Oh yeah, I separated all the slides.
Oh.
And then last but not the least is fractures. I'm not so sure though because on fractures there's also two that comes out. One is knee or leg fracture. Sometimes it might be related to arm fracture, but the most common one that comes out is hips. Okay, hip arthroplasty. Okay, so that's another one that might definitely be there as well. Right? Now, I have something that I still have to verify, but this might be a 9th NGN, which is psychosis.
Psychosis.
Right? Psychosis is the 9th NGN. What do I mean by psychosis? Psychosis is a mental health disorder. One of the classic type of psychosis is schizophrenia. Okay? Schizophrenia.
How do you spell it?
That might be it.
Ah, there.
And the last one is to dementia.
Dementia.
Dementia of Alzheimer's. There you go. You already know at least have an idea of what might be the main content of the NGN. Okay.
Okay.
So when you study NGN, make sure that when you create a notes or you review material, make sure you pattern into this sequence. Okay? Pattern into this sequence. Right? This is not, I can post that to like our remind. Don't worry.
Okay,
if you
perfect.
ever miss something, I will post it in remind. I also have a PowerPoint with practice questions. Don't worry about copying it or trying to write. I'll post it at the end of the presentation. So for the meantime, just try to as much as possible write your own notes if you want to listen to the discussion. Right? Yes. Oh, welcome. Right? So make sure that you're studying NGN in this sequence. Okay. Alright, any questions? No? Okay. Then we will start then with our discussion on the different fundamentals, testing strategy. There are several of you that is important, legality and ethics of nursing. Alright, and then ethical concept of nursing. There's gonna be ethical concept of nursing. So the one that they'll ask you on ethical concept of nursing to discuss it is they'll ask you about autonomy. They will ask you about veracity. They will ask you about another one is they'll ask you about advocacy. Those four. We will discuss it though in our lecture right now. So expect that those four will be coming out of your exam. Autonomy, fidelity, veracity, and
Advocacy.
what was that?
Advocacy.
Advocacy. Right. Advocacy. And like I said, don't worry about this. I will post this in our remind so you will have a copy of it. So first thing we will be discussing, because this is going to be on our exam, the way they ask prioritization and delegation is that you will see there are going to be a few questions on your test where they're going to tell you in the beginning of your shift, you are given this much patient, like 4 patients, which among the 4 patients that you're going to check first. Or they're going to ask you which among the 4 patients would be your priority. Okay? So, always remember, when it comes to prioritization, you have to make sure that you're either applying
See?
right? You can either use add 5, right? The other way to prioritize care is A, B, C, D, right? And the other way to prioritize here is as long. Right now, add by is easy. Add by is easy. I'm going to tell you now. It's easy because on your exit, as long as you see that the question has the word, and I mentioned this before when I visited your class, first or initial. If the question on the test has the word first or initial towards the end, it's going to ask you what should be the initial action of the nurse, or what should the nurse do initially? What should be the first action of the nurse, or what should the nurse do first? You already know, look for an answer that's what? An assessment. Look for an assessment. That's consistent on your exit and on your exit. Right? That's consistent. That is very, very consistent. Right? So, look for that. As long as you have an assessment, the way you will see it is that they would usually put 3 that are already interventions, that you're going to do something already for the patient, and then you will see one of the options is they're trying to assess, they're trying to determine, they're trying to check, they're trying to verify. Those are the terms that they use, that they will use for assessment. You won't always see the word assessment, so you might see what? Check, determine, verify, right? You see that, and the other 3 are interventions already. You already know. Pick that answer. That's the same also for your boards exam. It will help you a lot. You see that word first, initial, there's an assessment option, go for it. Okay? Except, here is the exemptions to the rule. Number 1 exemption to the rule. Okay? Chest pain. Especially chest pain related to angina pectoris or MI. If they're going to ask you, what should the nurse do first? And this is on med-surg. And usually it's tricky because they will put that assess the vital signs. They'll tell you that. Or assess the patient's heart rate or blood pressure. Guess what? If there is an option for positioning, that's the first thing you do. Okay? So always remember that for med-surg question, that there are specific positioning answers or options. That's usually the right answer. So why did I say that? If someone is having chest pain, or let's say for example it's an actual MI, and you're going to do an assessment first, what's going to happen? They can fall. They can get injured, right? So in that situation, if that question is to come up, because it will be there, heart failure and MI is going to be part of our exit. What should you do first? Ask them to do what? Sit down first.
Okay.
Right? That's an exemption to the rule. Right? So for that specific situation, you look for a positioning option. What do you do before you do an assessment for that patient? Ask them to sit down first. Okay? So that, just in case, they're not going to get injured. Okay? Another one that also exempts the rule. Patients that are having what? Shortness of breath or difficulty breathing. I'm going to tell you, the patient is having dyspnea. What should be the initial action of the nurse? And you're going to put an assessment to try and trick you. Like, oh yeah, Mr. Montano said, always go for an assessment. Guess what? There is going to be an option there that might say what? Elevate the head of bed. Or put the head of bed at 30 to 45 degrees. Guess what? That's the answer. That's another exception to the rule. Because why? Before you do an assessment, you want the patient to have easy breathing first, so that you can take your time and assess the patient. So how do you improve breathing? Breathing is not improved by putting the head of bed down. It's improved by putting the head of bed up. Okay, so in that situation, make sure that you actually put the head of bed up. Okay? So those are some of, the questions that would be an exemption. Okay, now, here's the thing. Because I want you guys to see the other thing about that. There's another version, so you have to be careful. Okay, why? Because sometimes I'll say, yeah, go and pick positioning. But here's the thing. If the positioning option is wrong, then the answer is still going to be what? Assessment. To give you an example. Someone is having shortness of breath, right? And the patient is complaining of dyspnea. The question is, what should be the initial action of the nurse, or what should the nurse do first? A, check vital signs. B, reposition the client in a side-lying SIMS position. So, if you didn't listen, you will be like, oh, I'll pick the positioning because Mr. Montano said that if there's an option for positioning, I should pick it. But guess what? In that positioning, that's wrong. That's wrong. Because what did I say should be the position of someone who has dyspnea? Head of bed, up. But the option actually said that to put the patient in a what? Side-lying SIMS. Which is what? Wrong. So in that situation, the best answer will still be what?
Vitals.
So I want you to be aware of that because I sometimes see students, they just jump in just because that's what they remember that I said. But analyze it. Is this correct? If I pick this, is this correct that if someone is having dyspnea, that I have to turn them into a SIMS? Because if it's not correct, then my best answer is still to what? To assess. Right now, but if the option is the patient is having dyspnea, what should the nurse do first? A, check the blood pressure. B, put the head of bed up. What would be the answer now?
Head of bed.
In this situation, the answer would be B. Why? Because the positioning is correct. And that's what you should do first for someone that this. You get it? Right? Because it can be tricky. That's how tricky it can be if you're not reading it from the So it's very important that when you test, read it in detail. Go over the entire question, go through each option one by one, and then eliminate the options that doesn't make sense. Okay? So that we can come up with the best answer possible. So prioritization of care. This is one of those things that they will be asked. Here's an example. This is how sometimes it comes up. This is how the question usually will come up. During a shift or during a change of shift, that's what you might see. The nurse receives reports on 4 clients. Which client requires the nurse immediate attention, or which client should the nurse see first, or which client should the nurse see immediately? So always think, is this an ABCD question, or is this a math law? Now, when I say ABCD, we prioritize what? Airway, breathing, circulation, and then D is disability. Now the question is, what falls under disability? So here are examples of disability. Pain is a disability. Hyperglycemia is a disability. Infection is a disability. Right? So something that's not related to what? Airway, breathing, and circulation. If they're not related to airway, breathing, and circulation, they are considered a disability. Right? So, the way that you would do it, because if you read the question, if you go over the option, these are all diagnoses. So for me, if I was the student, the way I will answer this is through what? A, B, C, D. I will look for A, B, C, D, right? So let's say, for example, letter A client with an infected wound who is receiving an antibiotic. Airway, breathing, circulation, or disability? Disability. Right. That's how you do it, you know. If you want to put a mental picture of yourself, I'll put D. Oh, that's a disability. So I know that that's really part of my last priority. Right? That's my last priority. I should really go for that. A client who is post-operative and has a temperature of 104.
Disability.
That's what? Also possibly an
Infection.
infection. Right? So it's also going to be what?
Disability.
Disability. Right? Okay. The next one, a client with chest pain who is diaphoretic and has a blood pressure of 88/56. Circulation. C. Right? Circulation. Right? So I know based on my priority, this is my third priority. So I'm getting closer to my main priority, right? A client who has been scheduled for a CT scan for kidney stone. Kidney stone. Now I found the answer. What's the answer?
C.
Right? No, right? So easy. You guys can do this. You just have to like practice on it. Make it like something that you do regularly. Okay? Even on your breakfast, lunch, and breakfast. Do it. You will saturate it soon. Okay? You need some time for some breakfast. But that's how you do it. Go over each option. So if you see a question like this on your exit, even on your board's exam, and they're asking you which patient do you prioritize, that's the thing. Go over each option one by one and ask yourself A, B, C, D. Label it. Label it in your mind. Okay? You will see. Alright? Alright. So that's an example. Alright, so I already gave you this an example before, right? You see what I meant about looking for keywords? If you read it, go all of it, right? And it's like I said, make sure you read it carefully. And then when you get to the end, he was last medicated at 3:30 p.m. Which action should the nurse take?
Initially.
That's consistent on any exam, whether it's the exit, whether it's the NCLEX. You see consistency, except if there's some kind of exception to the rule. So for this, because you're like even if you're lost, you can use the technique. If you're not lost, then you already know how to answer this. But let's say, for example, you just can't figure it out. Just remember the technique that I told you, and you will easily find the answer. What do you think is the answer here?
3 to 4 hours.
Who says A? Who says B? Who says C? Who says D?
D.
The rest, no, you're not even Saturday. So, very good. The answer is
D.
D, right?
Describe.
Consistent. Very consistent. You see that word initial, that word first. There, everything else is intervention, intervention, intervention. There's only one option that's different from everything else. That's the right
Assessment.
especially if it's an assessment. Right? Okay? Alright, very good. So here's the opposite of it, right? This is the opposite of it. So if you read it, it will look like it's exactly the same question, right? But it's a different version of the question. Why? If you read it here, it says at 7 p.m. the client complains of severe pain in the operative site area. He was last medicated at 3:30 p.m. Which action should the nurse take first? So now there's no word that's what? It should be done initially. There's no word that says what? Should be done first. So with that, here's the other rule. You can easily already eliminate what? You can already eliminate on your option, once you go through the option, you can already eliminate D. Why? Because it's not asking you anymore for what? For what's first and what's initial.
Okay.
And in this situation, you're not using A, B, C, D. In this situation, this type of question, like I said, you will use what? At bottom. Remember, at the beginning of our page, I said, if the question has the word initial or first, we'll be using at bottom. Right? So, there's no initial, there's no first. You already know that you're probably not going to pick an assessment option. Why? Because it's no longer asking you first or initial. Now, go back to the question.
3 to 4.
What is significant on the question that can help you answer this question?
Severe pain.
The significant one is what?
Severe.
No.
C.
Severe pain. Right? Because always remember, and this is going to be on your exit. There's a question on your exit on how to manage pain depending on the scale. Okay, now, there are 3 different pain scale levels, right? We have 1 is to 3, which is mild. We have 4 is to 6, which is moderate. And we have 7, 10 over 10, which is severe. gonna ask you this, right? Now, remember, when the pain is 1 to 3, this type of pain does not really require pharmacological intervention. Alright? It's more of what? Non-pharmacological. Right now, there are 3 non-pharmacological interventions they're going to ask you at the exit. Okay, that might come out. The first one is stents. Stents. Who remembers stents? It's a long word, right?
The electric thing.
Transcutaneous electric nerve stimulation, right? It's like a small machine with electrodes that you put on your skin, you turn it on, it actually delivers low voltage of electricity to actually allow, muscles to relax, right? It promotes muscle comfort. That's one of the very effective way of managing pain without using medication. Where is it effective? It's better applied for mild pain. Okay? The other thing, they're going to ask you effleurage and pétrissage. Who remembers effleurage and pétrissage?
How do you spell that?
The massage.
Oh, it's a
Alright,
massage.
so, just in case you don't remember, I'm going to show you because they're going to ask you this, especially on OB. This is going to be coming up.
I don't know. I didn't get that far. I don't think. Oh, tense? Yeah, mild. Yeah. Effleurage and what was the other one? I don't know. I have massage. Do you remember effleurage and what else?
Alright, so if they are using the flat of their hand just like this, right? And then they're going like this, circular motion, right? But not deep, just gentle massage using the palms of their hand flat. This is what we call as effleurage. Right here, I need to clear it. Effleurage, okay? So that's so you know, that's effleurage. That's a type of massage that is effective also for pain. The other one is pétrissage. Okay, pétrissage. So when you do pétrissage, you will see this is how it's done. So if they're doing a pinching technique like that, that's pétrissage. That's deep tissue. Okay? So pétrissage, if they're pinching the skin, they're putting more pressure, and that's for more deeper muscle relaxation, then that's pétrissage. Now question an OB. Which one is the OB massage? Pétrissage or effleurage?
Effleurage.
Effleurage. Get that. Okay? They're going to be asking that. So when they describe it, look for an answer that says what? Using the palms of their hand with smooth, gentle, circulating motion. That's effleurage. Okay? In OB's term, that's lamas. Okay? That's lamas. They do that on the uterus, right? That's lamas. Right? Which is, the other term is effleurage. This one is different. This one is pétrissage, which is deep tissue. So if the description is deep tissue, then you know the answer is
Pétrissage.
Right?
Is that for mild as well, or is it moderate pain?
I'm sorry?
Is it for mild or moderate pain?
Mild. Yeah.
Okay, thank you.
Alright, we're good in this one? Alright. So really quick, we're going our short break. Going back to the moderate. Yes. Correct. So repositioning, here's the other thing, repositioning the patient Cool and warm compress, that's also a type of what? Non-pharmacological intervention for mild pain. Distraction, like guided imagery, you know, like you tell them, you are now
Guided imagery.
with the water touching your feet.
Wow. What is it?
So we're not there. That's guided imagery, that's mild pain. That's also mild pain.
What's that about?
So those things mild. Now when it comes to moderate, which is a pain scale of 4 to 6, we know we're going to need what? Over-the-counter pain medication. Right? So 2 of the over-the-counter pain medication you can have on your farm, so you're going to have is acetaminophen and aspirin. That's one part of your farm question. Right? So the list, that's part of your list, right? The farm. Okay, so we're going to be asking you that. So over the counter is very efficient in controlling moderate pain. You apply some non-pharmacological intervention and then you give them the over-the-counter pain medication, like like I said, acetaminophen, aspirin, or the other one is NSAID or ibuprofen, right? That's steroidal. Then that would be something that's very helpful already for farm. Okay, now we'll discuss those medications more when we get to farm, because there's some things that I want you guys to remember about this. Now when it comes to severe pain, alright,
Opiates.
then we know that we should be looking for an answer that is what? Narcotics. Narcotics. Right? And narcotic is a big part also of your exam. Right? So one of the things that they'll ask you is, other than making sure that when it's severe pain, what type of medication do we look for?
Narcotics.
Narcotics, right? Or opiates. Okay? The other thing they're going to ask you is, once you give the opiate, what would be something that you need to watch the patient for?
Respiration.
Respiratory status, right? Now, what if respiratory status is not there? Then look for the other vitals. Right? Why? Because narcotics are CNS depressants. Right? So they're dangerous, although they're very helpful in controlling severe pain, right? Narcotics are CNS depressants. So what do I mean by that? They depress your central nervous system, so it actually makes your breathing slower, right? So it causes bradypnea, right? It also lowers your blood pressure, so it actually causes what? Hypotension. It also lowers your pulse, which causes what? Bradycardia. So if the option of have the respiratory depression is not there, then look for maybe hypotension and bradycardia as other side effect of using a narcotic. Okay, so that's very important to know because that's actually one of the things that they'll ask you after. They're going to ask you RX. Okay. Now, other than that, because it's a CNS depressant, it can also cause what? Sedation. Cause sedation. It can cause weakness. It can cause constipation. Right? Okay. So in that situation, those are the things that you want to watch. Okay. Now, the other one that's related to this, managing pain, that's also on our exit is
PCA.
going to be asking you this. Because that is related to the delivery of narcotics. Always remember, orally taken narcotics, if it's tablets, are actually more addictive, right? And causes, problem with long-term dependence. So that's why a lot of patients end up going to rehab and taking methadone. And remember, methadone is the rehab medication for opiate addiction. Right? Methadone is different from naloxone or Narcan, right? What is naloxone or Narcan?
Yeah, it's an abortive thing. Antagonist. That's one.
This is the one that is an antidote for what? Opiate
Opiate.
toxicity. Don't forget that. So for opiate toxicity, if someone is toxic of narcotics and you want to save them, you want to reverse the effect of the narcotic toxicity, then we give them what? Naloxone or Narcan, right? Especially fentanyl, right? Fentanyl is actually very, very dangerous. Very easy access. You can actually die in that. But if you want to save someone on fentanyl overdose, we give them what? Naloxone or Narcan. But let's say they're addicted and they want to go to rehab. The rehab medication is fentanyl. Okay? That doesn't reverse the effect. That's good. Right now, one thing to remember for PCA, and then we'll go on our break. It's called patient-controlled analgesia. Patient-controlled analgesia. So what does that mean? Who controls it?
The patient.
The patient. Who is legally allowed to press it?
Patient.
The patient. Right? So it's the patient that needs to press it and use it. Right now, this is one of the safest way of delivering narcotic and the fastest. Why is it the fastest? Because it eliminates the need for the patient to call the nurse and ask for what? Pain medication. That's the purpose of having a PCA. We want to eliminate the need for the patient to keep calling the nurse for what? Pain medication. Especially if they're in need of it. Because a lot of times if your nurse is busy, they're going to get it. They're not going to be able to give you the pain medication immediately. And now your pain is so severe, it's not going to be given. Okay? So to prevent that delay and to prevent you from calling your nurse often to ask for pain medication, they use the what? PCA. It's also safe. Why is it safe? The dosage delivery is what? It's locked. It's set to deliver only the prescribed amount of medication to the patient. So even if the patient kept pressing it and they already reached their limit, they need to give medication. It's wrong. It's wrong. Okay, so why did they say that? There's a question on their exit also that they will ask for examples of medication error. Right? Examples of medication error or examples of incident report. That's what they're going to ask. There's going to be a question on, identify situations where you need to write an incident report. And one of the situations there is that the family member is actually pressing the PCA. Right? Now the question is that an example of an incident report? The answer is no. No, it's not. Why? Because there's no way to what? To cause a medication error there. Because it's what? It's locked. No matter, even if the family tries to press it and the patient has already reached their limit, it won't deliver more medication than prescribed. Right? So let's say, for example, give you an example. Family member pressing the PCA. B, IV fluids being delivered more than the prescribed drip rate, or the patient got more IV fluids than the prescribed drip rate, the answer is that. That is the one that actually requires a report. Why? Because you actually gave more than the recommended IV fluids. Right? Remember, on a PCA, you won't make that error. Why? Because the PCA is locked. Right? Always remember that. And also don't forget that who again is legally the one that's supposed to press the button?
The patient.
So if you see a family pressing it, what do? You tell the family not to
Press the button.
Okay. Have to do it. Alright? We clear? Alright, let's go for a break, guys. Long time, so we'll be back by 10:20. They are going to be asking you the specific tools that you can use for your assessment. So, let's show you specific tool. So this one right here, let's make this smaller. There you go. So just don't forget the tool when it comes to pain assessment. Also, the number one thing we use is the verbal response. We ask the patient what is the severity, the location, and the character of their pain. But for certain individuals, especially like kids, you want to use flat, okay? Because you don't want to just ask a child a question. Even later on, there's a question on related form that if you're going to give a medication to a child, how do you identify the child? Remember, you don't ask a child their name, you don't ask them their medical record number, their date of birth. It's very unreliable. So, same way goes for pain assessment. If you want to determine the patient's pain scale, and they're young children like this, especially younger than 3 years old, you want to use the FLAC. Okay? So, FLAC stands for specific things that we look for, like the face, the legs, the activity, the cry, and consolability. Just remember that, okay? That you assess them based on their FLAC. Now, for adults that are non-verbal, we use the Wong-Baker face. Okay? Wong-Baker face scale. Okay? Now, there's one more scale that they're going to ask you, but not related to pain. The scale is actually called AIM, but it's related to mental health. Anyone remember the AIM scale on mental health? They're going to ask you that.
One question. Daddy.
The AIM scale. The AIM stands for Abnormal Involuntary Movement Scale. So that's one more. I just want to make sure I already tell you because I might forget later on when we go to mental health. But this is another chart scale that they use to determine certain conditions of the patient. But this one is for mental health. Where do they use AIM? They actually use AIM for EPS. EPS stands for extrapyramidal syndrome, right? Especially for those patients who are taking antipsychotics. Let's say they're taking Haldol, Seroquel, Zyprexa, right? Primarily medication for schizophrenia. One of the really severe side effects of that is EPS, right? There's 4 EPSs. Who remembers what are the 4 EPSs? You have
Dyskinesia.
Right? You have
Akathisia.
you have acute
Dystonia.
And then the other one is pseudo
Parkinsonism.
Pseudo-Parkinsonism. So just in case, just remember, if they ask you how do you determine tardive dyskinesia, akathisia, acute dystonia, pseudo-Parkinsonism, you already know the answer. The answer is AIMS. Abnormal Involuntary Movement Scale. Okay? Just wanted to mention that because we're already on tools to use. This one are for pain. This one is for EPS. Okay? It's called AIMS. Okay? Abnormal Involuntary Movement Scale. But for pain, we all know the answer is either flat or Wong-Baker or verbal. The patient tells you, this is my pain. Alright, any questions? Move on to the next one. Alright, so here's another one that just an example I'm going to show you, right? It has the word first or it has the initial. You know the answer is to
Determine.
right, assess. Right. So just don't forget that. Very good. Alright, so here's another one that's very similar also. There's the word
Initially.
Alright, so you're going to look for an assessment, which is Identify. Now they use the word what? Identify. Not assess, not determine. So I want to make sure that I also, show you this so that you know that they keep changing the word, but they actually mean the same thing. They mean what? Assess. Mean the same thing. Okay. Also, a few things that I want you to remember so that it's easy for you to eliminate options. Okay. Eliminate options that have this word. Right? Okay. Eliminate options that have this word. And eliminate options that have that. Okay. Also, words like never, all the time. Okay. Because those are generalization words, which means that in reality there's always exceptions to the rule, and they're not usually the best answer. You can easily eliminate them. Okay, so let's say for example you don't really know the answer. So use a test-taking strategy like this. If you see an option with the word all, never, all the time, always, then you know you can already what? Eliminate that. And boom, there you go. Don't pick that, right? So always, don't pick that, right? Because that word. There's all again, you don't pick that. So you can easily isolate the right answer. And again, caution though, this does not apply for everything because some options might not have the word all, right? But in situations that it does, and you can't find the answer, this is one way of helping. Eliminate the options that have those kinds of words. Okay. Might be helpful later on. You never know. You might be in a bind, can't really find an answer, then you can use that as a thing. Okay? Alright. Any questions? No. Alright, so here's another example. This one though is ABCD. Let's practice again. What do you think would be our ABCD here? Which one would be your priority? Look deep. Gotta find the deep meaning to it. What's the technique again? Go through it and what? Write A, B, C, D. Here's the technique again. So I remind you, so you keep using it. It's a repetition. It's a really good teacher. So, monitor your output. A, B, C, D. Monitoring your output. The airway, breathing, circulation. Really. Although it might be related sometimes, but that's secondary to a problem with circulation, not really circulation. So what is it? Monitor the temperature. Temperature monitoring is usually related to what? An infection. ABCD. Check wound dressing. Check wound dressing. ABCD. D. Very good. Why? Wound dressing is where patient can actually what? Bleed. That's right. C. Check patient comfort. ABCD. What's the answer? Just ask yourself that. It takes time, but the key again is repetition. Go to ChatGPT. ChatGPT, please give me NCLEX, questions with options and answers about prioritization questions or prioritization of care. So that you can practice all prioritization. It's all of it. Okay? Will help you a lot. Alright? So you can start using a lot of this things here. Okay? Alright, same thing, right here, A, B, C, D, right? But, here's the thing though. So A, B, C, D, if you look at it, which one? Letter, so we can write it down, right? So we have pneumonia, it has developed breathing, airway, right? The client has early dementia and awoke confused with their location this morning. Dementia, the client who is post-operative and has a urine output of 50, B or C, post-operative, right? Because of the operation, so it's still C, right? A client who is scheduled for discharge. D. Answer is A. Alright, so here's one thing though, an example of where you should be careful. This is also ABCD, right? 60-year-old patient on a ventilator for whom a sterile fusion specimen is needed. So the issue is specimen selection. ABCD. D. A 55-year-old with COPD and a pulse oximetry reading of 90 on the saturation. Airway breathing or circulation? It's airway, it's breathing, but not a problem, right?
Chronic.
Yes. COPD is normal at 88 to 92. So not a problem, right? So even though it's airway, breathing, and circulation, there's really no problem with the airway and breathing, right? Okay. Letter C, 70-year-old with pneumonia who needs antibiotics. Pneumonia is?
Infection D.
It's an airway infection, right? So that is what? And D also because of the infection, right? And a 50-year-old with asthma, that is a risk for shortness of breath. Also, airway, but
It's at risk. It's not happening now.
as I said, always remember, don't give an answer with the word risk. Okay? So just a reminder. You will see that on your exit. Do not prioritize risk. They don't matter. Why? It's not happening. It's not happening right now. Right? What matters is the actual. The actual versus the risk. You don't pick answer that has the word risk. Okay? So even though this is also an airway, we've got two airway problems here, but this one though is only a risk. So it should not be a priority. Okay? So another technique there, avoid options that have the word risk. Okay? Alright. Now this one I also mentioned this already before. Mental health. Mental health uses the prioritization of Maslow. Maslow's hierarchy is going to be asked on your exit, especially on the psychosis NGN. They're going to ask you prioritization of care. Always remember that when it comes to mental health, we use the prioritization of Maslow, right there. Maslow, right? So Maslow says that we have different priorities, right? So, go ahead and answer this. What do you think would be the answer? Use Maslow. The answer is A, B, C, D, F, D. Now the answer is letter D.
Oh,
Very good.
what?
Right? So why? Maslow says that the number one need is the
Physical needs.
physical or the physiological need. Number two, safety is only number two, not number one. Safety is not number one. Right? The number one need of a person is not safety. The number one need is what? Food, water, shelter, clothing, air, oxygen. Right? That's what they need. Okay? So always remember, if it doesn't tell you something that is related, because it's going to be on our exit, related to suicide, then you shouldn't pick it. Now here's the other version of how this might come out. The nurse is caring for a patient with severe depression. There you go. The nurse is caring for a patient with severe depression and asks about shark container. Or they'll ask you, what is that container right here? Right? What is the answer now?
Monitor for
The answer now is A. Could be B. Could be D. But the answer now is A. Why? Because there's actually evidence of possible suicide. Okay, so always remember that suicide becomes a priority when you read the question and there's evidence of possible suicide. So what are the different evidence? What are the different signs and symptoms of possible suicide? Giving away things, valuable things, right? Asking about things that can be what? Harmful. Sudden burst of energy or suddenly getting better immediately the next day. Why? They're trying to trick you. That I'm good, right? You don't have to watch me and then they'll commit suicide once you turn your back, right? Another one. Okay? Your feeling of actual plan. They have a plan. I plan on using my shoelace and putting it on my neck. I feel like the world will be a lot better without me. I feel like the world will be a better place without me, so I'll use my shoelace. It's a plan, right? Okay? There's another one. Evidence of possible suicide. So suicide becomes a priority only when there's an actual what?
Evidence.
Evidence. Okay, don't forget that. Very important to know. Another evidence of possible suicide is when there's restless and pacing. Okay, that word, you see that? Restless pacing. Watch them closely because they can probably what? Commit suicide. That means they're very, very anxious. They're ready to go. Okay? Alright? Are we clear on that law? Yeah. So if there's no evidence of suicide, what's the priority? Physiologically, food, water, shelter, air, all of those things. Okay? Alright. Very good. Look at this one. A client with depression expresses suicidal ideation to the nurse. What is the nurse's priority action? Already reported. Why? Because there's already evidence of suicide. They have already what? Idea. They have an idea of possible suicide. So if there's an idea, there's a plan, they're going to do it one-to-one prioritization, right? You have someone with them and report it immediately to the physician. We can't take our time anymore in this situation because they're probably going to commit suicide. Okay? Very good. Alright, so there are other examples here. We'll go over them later on, but I just want to make sure you know this prioritization here. Also, I wanted to add this here because someone asked me what's phytonadione. Don't forget that is vitamin A. Okay, yes. That will be on your exit. On your exit, they don't call vitamin K vitamin K. They call it phytonadione. So, one of the questions here, right? One of the question here, let's say they're going to ask on newborn, and then they're going to ask you, what is a shot that is given to the newborn before discharge? So we all know it's what? Hepatitis B and vitamin K. So you're looking for vitamin K, you're going crazy, there's no hepatitis B, there's no vitamin K in the option, you say, what the heck, this is the wrong question. But then there's phytonadione, so that's what? Vitamin K. Right? So don't forget. Phytonadione is vitamin K. Right? Don't forget that. Phytonadione is vitamin K. So if you can't find vitamin K, but it does say phytonadione, that's what it is. That's vitamin K. Alright, and then like I said, neutropenia, low WBC, same as granulocytosis, it's also meaning the same meaning, WBC. And don't forget the one that I said, thrombocytopenia and low inflammation. This word comes out a lot. We'll start with our exit. We want to make sure that you remember it. Alright, there you go. Prioritize acute, meaning something that is happening right now, not something that has been happening for a long time. And also prioritize the now, not the risk. Okay, avoid it. Alright, next, delegation. There's going to be several questions on our exit where you have to work with your UAC. Okay? Right. Now, there's also a question on our exit that's going to ask you what should be delegated to the LDN. So there's actually two types of questions that's going to be on the exit. What to be delegated to your CNA, and the other one is what can be delegated to the LDN, licensed vocational nurse. Always remember that when it comes to licensed vocational nurse, what can be delegated? Medication administration, right? Wound care, specific procedures involving surgeon, NGT, right? But when it comes to assessment, always remember it's reassessment. Reassessment of location. Why? Who does the first assessment? RN. Okay? And also reinforcing of why? Who does the initial teaching? RN. Okay? But an LPN, of course, can assess, they can also teach as long as reassessment and teaching. Okay. So that's it. Now, CNA, here's an example. What are things that can be delegated to the CNA? If you were the LPN, what would you delegate to your CNA? Radio. Check the vital signs. Alright. What else? That should be right. Provide sit back. Alright. So, here's the thing. Always remember, one way to eliminate the options, look for the simplest one. Look for the simplest one. Okay. Also, avoid situations that you have patient with acute condition. Because acute condition cannot be delegated to your CNA. Also, a CNA cannot eat. Not literally eat though, okay? What does eat mean? Eat stands for they cannot educate or evaluate, they cannot assess, and they cannot teach. So they cannot evaluate, they cannot assess, they cannot teach. Cannot teach. Right? Remember that. So even though it says, to teach how to brush their teeth, you know that's simple, right? But the word teach makes it what? Wrong. Because again, the UAP or CNA cannot evaluate, they cannot assess, they cannot teach. So, in this situation, look for the simplest, look for the one that is not acute, and avoid things that says evaluate, assess, and teach. Alright, let's go over the options for CNA. Provide a sit back to a client who has a 4-6 vaccination 2 days postpartum. 2 days, meaning acute or chronic?
Chronic.
That's already what? It's already chronic for 2 days. Postpartum, the acute is what? The first day. Because the first day is when hemorrhaging can happen. That's the second day, and then just to what? To provide sit-back. We're just helping them on sit-back. So simple, so good to us. It's a good thing. Did I not? Alright. Observe an area. When you say observe, that stands for assess. Yeah. Also, 1 day postpartum. Right? Check vital signs on someone who has gestational hypertension. That's what? That's acute. That would bring eclampsia. And that's the eclampsia. So, they cannot. Although they can check vital signs, but the patient is acute gestational hypertension. Right? Find out to changing the perineal pad and applying following delivery. So, following delivery. Acute. The answer is okay. Do that. Find acute versus chronic. Make sure it's simple, something that's easy to do, and avoid heat. Avoid heat. Avoiding heat. And then again, ask, ChatGPT, can you give me several questions on, delegating to the UA? So you can have a lot of samples, okay? But, here you go. Alright, this is the LDN. All you need to remember. Spelling it out. Memorize. Right? memorize. Okay? Right, so that you know what they can do. They can, this is what an LVN can do, this is what a UAP can do. UAP, bathing, grooming, dressing, ambulating, feeding, as long as the patient doesn't have a diagnosis of dysphagia. Alright? If the patient has a diagnosis of cannot be delegated to a UAP. Okay, dysphagia. Why? Dysphagia patient requires teaching, they require coaching, they require assessment, prioritization of care, because they're high risk for aspiration. Right? They can choke, so you cannot delegate them to a UAP for meal. But if it doesn't have that, okay, then you can delegate them. Now be careful. A lot of times, this is where I see people do this. This is it. They're given a patient with stroke. Okay, and then one of the options is, what can you delegate to the UAP? Assist with meals. That's actually the right answer. Why? Because it only said what? Stroke. It didn't really say they have what? Dysphagia. So sometimes we think that they have stroke. The thinking is automatic, they have dysphagia. Remember, not all stroke patients have the same manifestations. Some of them might have dysphagia, some might not. Some might have paralysis, some might not, right? So always remember that this word has to be there in order to not delegate feeding or assisting with meals to your baby. Okay, is that clear, guys? Alright. So, other than that, repositioning, yes, bed making, specimen collection, as long as the specimen collection technique does not require sterile technique. Alright, I'm going to give you an example. 24-hour urine collection, can you delegate that to a UAP? Yes, very good. That does not require sterile technique. Even though they are polycatheter or not, that doesn't require sterile technique. Because you can collect the urine from the bag, or you can just ask them to what? Urinate. As long as you collect the urine within a what? 24-hour period. Alright, now, in and out cat, straight cat. Can you delegate that to a UAP? No. That requires what? Sterile technique. Alright. Next. Stool OB. Stool for occult blood. Can you delegate that to a UAP?
Yes.
Yes, because a feces is not sterile. Yes, the feces. It's not sterile, so that can be delegated to a UAP. Okay. Also, sputum sample, as long as it doesn't require suction. Okay, so if they can pop it out or expectorate, that can be delegated to the UAP. But if it says requires suctioning, then that would be what? That would be wrong. Okay, because again, the UAP cannot suction because they cannot assist. Okay, is that clear, guys? Alright, very good. Other than that, post-mortem care can also be delegated to the UAP. And then intake and output, they write down the intake and output, vital signs, and even blood sugar. They can collect that too. As long, again, as the patient is not what? Acute. They have to be stable. They cannot be unstable. If they're unstable, then you cannot delegate that to a UAP. Okay, don't forget, so just memorize. Okay. Any questions? No? Alright. Okay, very good. How about in-stream cat? Urine collection, can you delegate that to a UAP? No. Okay. Because all they need to do is assist the patient doing a in-stream cat. Now, if it says collect urine from the catheter port, can you delegate that to a UAP? No, because that one requires sterile technique. Okay. Alright, good job. Very good. Alright. So let's take a look at this practice question. Now one more thing, always remember also, a UAP cannot check start. They cannot go over history and physical and legal documentation in the patient. They're not allowed to look at that. Although in the real world they do, but for your test, right? For your test, you cannot fix that. Right? Alright, so the nurse assesses a client with a pacemaker while a UAP measures the client's vital signs. The client's vital signs change suddenly, and the nurse determines that the client's condition is worsening. The nurse is unsure of the client's resuscitative status or advanced directive and needs to check the client's medical records or which action should the nurse implement? Alright, so let's go over it and then let's, like I said, the way to you answer a question is go over each option and then ask yourself, is this okay? Ask the UAP to check advanced directives. We know that is what? No, UAP cannot check what? Legal documents, right? Retard. Ask the UAP to complete an assessment. No, the patient is what? Accused, right? And again, the UAP cannot eat, right? Cannot eat. Okay, so we have to check the medical records and continue to assess the client, and then request the UAP to call the charge nurse to check the advanced directive. So this one would be wrong, right? Why? Okay, very important to do not make an option that you will leave the patient. As the nurse or the patient, it's always best to pick an answer that you stay with the patient and you actually ask someone else to go and do other things for you. But you have to stay with the patient so you can actually what? Assess and determine the decision of the patient. So the right answer is after UAP to call the charge nurse, so the charge nurse can actually check the records or advanced directives. Is that clear, guys? Yes. Alright, so don't pick an answer where you have to leave the patient. Avoid that. Stay away from that. Okay? The LPN and the UAP entered the patient's room and found the patient unresponsive on the bed. Based on this finding, what will the nurse do initially? It's a little bit hard. You have to really analyze it. But use the technique also that I teach you. Where I'm going to see if you guys can remember it. Alright, so let's do process of elimination. Right? Let's do process of elimination. So, unresponsive on the floor, right, or on the bed. What would the nurse do initially? Ask the UAP to check the advanced directive. Alright, patient is acute right now. Assign the UAP to check vital signs. No, the patient is acute right now. You have to call 911 or ask the UAP to get a glucometer. The other clue to this question is so we're looking for right, that is the answer. Okay? Why? Unresponsive doesn't mean did it say that they don't have a pulse? Say they're not breathing? Non-responsive means they're just not responding, they're just not saying anything or moving. Right. Okay. Always remember, when you have a patient that's unresponsive, check the pulse, you check the breathing, you check their blood sugar, even they're not diabetic, right? Because they can be hypoglycemic also, even if they're not diabetic. What can you ask the UAP to do? The glucometer. Check the sugar. Okay? There you go, guys. Any question on that? No. All right. All right. So on religion. Religion part of culture. The focus is on Orthodox Jew. The other one is Muslim. And the other one is, if I'm not mistaken, Hinduism. Correct. Hinduism.
Social.
Yes. 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 Those are the three things that might come out.
Orthodox Jew, Muslim, tsaka Hindu.
Muslim, and Hinduism. Alright? Alright. Alright, listen up. Let's go through this. A nurse is supervising a newly licensed nurse who is female while she performs post-mortem care on a male client with Muslim. Which of the following actions by the newly licensed nurse should prompt the nurse to intervene? So there's no technique here. The technique is just make sure you know what's for Muslim, right?
That would be the same.
The answer is
Same gender.
correct. Very good. B, that's right. So this requires intervene. So here's the thing though. I just want to make sure you guys are aware. If it's asking for needs intervention or needs further teaching, we're looking for something that is being done what? Wrong. Wrong. Okay. But if it's asking for, something that the patient understands, or the patient is clear with the teaching, then we're looking for something right. So it does not require intervention, right? So we're looking for something right. So we're looking for something that is being done wrong. So the answer is letter D. Okay. So always remember post-mortem care in general, because this is going to be on our exit also, post-mortem care. When someone dies, you don't remove the dead. Okay? You remove the line. Like the IV, the monitor, if they have any kind of other devices, you remove that. But you don't remove the what? The denture. You want to make sure that their face is as normal as possible. Also, make sure they're not all the way flat, that the head is slightly elevated, low power. Yes.
Wait, so
I'm sorry.
why can't they body
Why can they open? So the answer
It has to be the
is,
same
why is it the
gender.
same ingredient? Muslim is a very strict religion that they actually require it has to be the same
Gender,
sex.
yeah.
So if the patient is male, the nurse has to be male, female, female. The other thing is the rule on postmortem care is actually has to be the family. Okay, so it has to be the family of the same sex. So if the patient is male, then it has to be the male family member. It has to be. It has to be the male family member. That has to be. Right? And always remember, if they're a patient there, they have to be assigned to a nurse of the same sex. It cannot be, if the patient is male, they cannot have a female nurse. It has to be male nurse. Okay? Alright. Disconnect the cardiac monitor, that's right. It doesn't require intervention, right? Remove soiled linen, that's right also. Right? The other thing to remember for Muslims, when they actually die, you have to face them towards the Mecca. Mecca. Okay, they have to face Mecca. So their body has to be facing. So he's like this. Right? I know, it's difficult, right? Yeah. So yeah, they have to face east, okay? Alright, very good. The next one, here we go. The nurse is contributing to a plan of care for who practices Muslim faith. Which of the following actions should the nurse include in the plan? Letter C. Yes, they can actually eat pork. Also, no alcohol, right? No alcohol for Muslim religion. Okay? No pork, no alcohol. Okay? Alright. So it has to be something that is out pork. Okay? And again, also no alcohol. Okay? Alright, so the other one, to remember, organ donation is prohibited for Muslims. Okay? Autopsy is also prohibited for Muslims. Okay? And even an Orthodox Jew? Okay, but don't worry, I'll give you guys a copy. But yeah, go ahead if you want to take a picture.
Oh, God.
It's like it's good faith actually. For Buddhists, it's good faith donate if you're sharing one part of your life. Alright, so cremation, very important. This one comes out sometimes on your exit into. They actually want to be cremated and then the ash has to be put into the holy river. Okay, so for cremation, Hindu, that's what they do. I think so, but I'm not sure if they actually have that. I think it's the same one. 24 There you go. Okay, so again, don't forget Hindu. Okay, there you go. Cremation. Orthodox prohibit cremation, and also Islam or Muslim prohibit cremation. Right. So also for Hindus, they don't eat beef. The cow is actually considered holy thing. Sacred animals now, so alright, let's take a look at this. Orthodox Jew. The nurse is observing an AP who is preparing to deliver a meal tray to someone who practices Judaism. On the tray is roast beef dinner with non-fat milk. Which of the following actions should the nurse take? Take it back. Apple juice. So what are we gonna pick? So always remember, for Orthodox Jews, they actually eat food that is what? Kosher, right? Kosher. You gotta remember that. Don't forget the term. Kosher. There's a special preparation. There's a special ritual for it, right? So let's take a look. Here's the thing. For Orthodox Jew, allow the AP to deliver the food tray. That would be wrong. Okay, why would that be wrong? Here's the thing. You cannot have two animal products in the same tray. Okay? So even that, if that says cheese, you can't have that. Why? You cannot have two from animals in the same tray. Egg and let's say it says egg and roast beef. No. Why? Because you have two animal things in the tray. You can only have one animal thing. Okay, so just in case, if this sometimes comes out of your exit, chicken sandwich. Can you give them chicken sandwich? Can you give an Orthodox Jew chicken sandwich? Yeah. Right? But if it says chicken sandwich with cheese, no. Right? So that's it. That's a good example there of what I'm saying. Okay? Alright? Chicken sandwich, you can give them chicken sandwich with cheese. No. Okay? Alright? So this will be wrong. You're going to cause a big problem here. You're probably going to get mad at you and report you. The other one is replace the non-fat milk with apple juice. You can't do that. Once you put the two animal products on the tray, the entire tray is a sin already. Sin. Oh my God. Alright? That's it. It's a sin. So that entire tray has to be what? It has to be replaced. It has to be replaced.
That's a lot of weight.
Yeah. Alright.
So it's B?
So, then it's replaced it with a juice. So what's the right answer?
D.
Yeah, different tray.
Unless they have to.
Let's take out dementia. You hear that? That's a technique. You just kidding. Just kidding. Don't answer that. If they have dementia, you can just walk out and leave the tray. Don't fix that, okay? That's not a technique, alright? That's gonna get you the wrong answer. You still have to change the tray. helps you the user. The nurse should identify the which of the following food together on the same dinner tray, violating religious practices.
Okay.
And then again, if they say there with dementia, right, then nothing violation. Just joking, don't, okay? So what's the right answer?
Hey.
Very good. To animal products. Okay? Also, here's the thing. If they actually give you seafood, can I give you an example?
No shellfish, right? Go ahead. No shellfish. Tilapia. Salmon. Oh yeah, that was salmon.
Seafood will you give the patient?
Salmon.
It's gonna be what?
Salmon.
Salmon.
No shellfish.
Salmon. Why? They don't eat crawling fish, fish without any, seafood that doesn't have any fins or scale, right? Shellfish, they don't eat that. Crabs, they cannot eat that. Okay, so it has to be something that has fins and scale. It has to be something that, are actual fish. Like, let's say, salmon, halibut, mahi-mahi, tilapia, those stuff, okay? Right? So again, if it doesn't have fins or scale like crab, oyster, cannot give that. Cannot give that. Right, guys? And also no pork. Okay? Orthodox Jews, no pork. Okay? Alright, very good, guys. So here's some of the things to remember. Yeah. Yeah, they can have sheep, goat, deer, gazelle, goat, wild goat, Isaac.
That's a deer, right? It's a deer.
Antelope. Alright. There you go, guys. Alright, so here's a few things to remember. Also, Muslim and Orthodox Jew, no pork, no alcohol, right? Kosher is the food for Orthodox Jews. Jehovah's Witness, this is for your NCLEX. Just remember, the one thing that they always ask here is, no blood transfusion unless the blood came from them. So if it's, autologous blood, they will accept that. Alright, any questions? Easy to remember, right? Okay, next. Legality and ethics. Okay, so. Alright, so here's a question on some of the ethics and legality. So when it comes to ethics and legalities, the things that will come out of our exit is topic of advance directives, informed consent, the ethics of autonomy, right? Veracity, fidelity, and being a advocacy. And then they'll also ask you about assault and battery. Okay, so just remember those, because those are the things that will come up. Okay. So here's autonomy. Which situation is promoting autonomy? See? Okay, but here, let's take a look. You're caring for a patient who has been recently diagnosed with chronic illness that requires long-term management. The patient expresses reluctance to adhere to the prescribed treatment plan due to the concerns about its side effects and impact on their lifestyle. How should the nurse prioritize promoting patient autonomy in this situation? Letter B. Right. Give them the right to what? To make their decision. Whether it's good or not, they have the last what? Decision. All we can do is tell them the benefits, tell them the risk, right? The bad effect, the good effect, but at the end, they're the one who's going to make the final call because they have outputs. Okay? So the answer is respect the patient's right. Correct. Right, next. You are caring for a patient who is scheduled for a procedure later in the day. During your morning assessment, the patient expresses anxiety and asks if you can stay with them during the procedure. You assure the patient that you will do your best to be present. However, as the day progresses, it's a long story. You become increasingly busy. Consider patient care responsibility. How should you address this situation while maintaining fidelity? So what does the term fidelity mean? What do you do? Keep your nice. Again, okay? Keeping your promise. Keeping your promise. So which is an example of keeping your promise? Letter B. So that you fulfill your promise. So don't forget that. If the question is fidelity, promise. If the question is autonomy, independence, right? Make decisions. Right? Right? Alright, next. You are caring for a patient who has been diagnosed with a terminal illness. The patient's family member asks you about the patient's prognosis and life expectancy. How should you prioritize the principle of veracity? Veracity, what's the term veracity? What does it mean? To tell the truth. So don't forget that. Veracity is telling the truth. So which one is telling the truth? Answer is letter C. Yeah. Yeah, provide a family member with the honest and accurate information. Telling the truth. Be honest. Alright, is that clear, guys? Veracity? Good. Alright, here's another one. The nurse is assisting with teaching a class on ethical principles. The nurse should include that protecting the life safety by not causing them harm refers to which of the following ethical principles? Is what? Non-maleficence. Yeah. Beneficence means doing good. Non-maleficence means not doing harm. Yeah, remember like maleficence? Disney? Beneficence is bad, right? So not doing bad. Non-maleficence. Alright, here's the last one. Advocacy. You're caring for a patient that needs emergency surgery. The patient says, I need a rotten egg. Rotten egg, not rotten anything else. Needs egg. Placed under the operating table. This will keep me safe during the surgery. The doctor refused because it is a problem for infection control. What will be the actions that the nurse will do to show the principle of advocacy? So advocacy, what does the term advocacy mean? You what? You advocate for the patient. What does that mean? You stand up for them. Right? You fight for what they believe in. Okay? So what is something here that you're fighting for what they believe in? Letter B. Doctor, is there a way that we can do this? Do they really need it for the surgery, right? Yeah. Or you can place the egg and then remove it during the surgery. That's
Yeah. Put it back when it comes.
The egg, and then during the surgery you remove it. But then they die, right? No, man.
The egg work.
Now you know why they die. You remove it.
Gotta believe the egg.
Alright. Okay, so what does advocacy mean? You fight for your patient. Okay? Talk to the doctor, and the doctor says no, then no. But at least you actually show advocacy. Yes. Don't forget that, okay, guys? You're going to be asking those things. Alright, so here it is. Here's the definition. Remember it, remember those examples. Okay?
Okay.
Alright, the next one, confidentiality. Before we answer this, before I forget, one of the questions they'll ask you on confidentiality is, what is the best source of internet? So it's not people, not, Verizon. Right? So the answer should be, the best source of internet is an internet with, don't forget this, okay? There you go, VPN. Right? Virtual, personal, or protected network. Okay? VPN. Don't forget, it has to be a VPN internet. Whether it's Wi-Fi, whether it's hardwire, it has to be VPN. Right? Don't forget this one. Right? The other thing, when it comes to confidentiality, if you want to research on certain health information, what is the best source of information?
.edu.
Wikipedia. No, right? The answer should be what? ChatGPT.
Peer reviewed. Yeah.
Yes. Alright, so peer reviewed for something that is .org, .edu, and not .com, .gov. .edu, gov, and .org. It has to be those three. EDU, gov, or org. Alright? Okay, so it has to be gov, EDU, or org. That has to be the website you have to go to. Okay. Alright, and last but not the least, when it comes to confidentiality, can you actually transfer patient information during electronic tours?
Yeah.
Yes. But
It's encrypted.
yes, make sure you look for that word. Encrypted. Right? Encrypted. Look for the word encrypted. Okay. So as long as it's encrypted, that means it's locked, that means that it is actually coded. You can transfer information, whether it's fax, whether it's email, as long as it is encrypted. Okay? Alright. The other thing, please make sure you're aware of this, that you only share, because they're going to be asking you, who can you actually share information with? Remember, you don't share your username and password. Don't share that with anyone else, right? And you only give patient information to family members or healthcare team that is directly caring for the patient. Okay, so it's a little bit tricky with family. Okay, so between the spouse, husband or wife, right, and the health proxy, who do you actually give the patient information to? The health proxy, not the husband and wife. Okay, why? The health proxy is another term for PPOA, durable power of attorney. That means that that specific person was assigned by the patient to represent who? The patient. So, unfortunately, if you're the husband and wife and you're not the DPOA, well, there's something wrong, right? Right, so, who do you give the information to? Not the husband and wife, but to who? The DPOA. Same with nurses. If you have a nurse working on this floor, There's a nurse on the third floor, ask you how is your patient doing, are they okay? Can you give that information to the third floor nurse? You can. Because that nurse is not directly what? Caring for the patient. That's the breach also of confidentiality. Okay? Okay? Is that clear, guys? Alright, so let's take a look at this. A nurse is giving a presentation about client confidentiality to a group of newly licensed nurses. Which of the following actions should be used as an example of violation? Violated confidentiality. Take a look. A. Discussing the client's surgical procedure with the nurse manager. That nurse manager is what? That's the manager. So that manager is the what? It's the last floor, right? So now, reporting laboratory findings to a member of the client's family. Yes. That's the violation. If you can't just give that to what? To any member of the family. The other one is notifying the provider of the physical examination finding. Well, that's the doctor. Don't tell that your doctor. Yeah. Lose your job. Identifying the client by name when making a referral for the home health service. So what violates the privacy or confidentiality? Selling it to the family. Remember, who do you sell it to? The DPOA? Or what's the other name for DPOA? Health care problem. Don't forget, they're the same thing, okay? Durable power of attorney and healthcare property. Alright, very good. Alright, we're gonna go now to torts. Here's some torts. Let's take a look at this tort. A nurse is caring for a client who is competent and refuses further treatment and asks to sign out of the hospital against medical advice, or AMA. The nurse notifies the charge nurse and tells the nurse that the provider has recommended restraining the client. Restrain them. Sign them up. If necessary, to keep her from leaving the hospital. The nurse refuses to implement the action based on the knowledge that restraining the client will be committing the following tort. What do we do if we restrain them and they're not a 5150? You're going to do a what? False imprisonment. Can't keep them. Unless they are a whole, danger to self and others, 5150, right? Then you can't really restrain them or prevent them from going out. You can sign an AMA. Even if they don't sign an AMA, they can do it. You don't have the right to hold it. Alright. Next. A provider prescribes a brief period of strict bed rest for a client who is post-operative. The client calls the nurse and asks to use the bedside commode. Knowing that the nurse from the previous shift allowed the client to get out of the bed and use the commode, she assists the client to the commode. The client, sustained an injury to the operative area while out of bed, which is the following tort did the nurse commit? Is A. The answer? Negligence. Negligence. Okay? Negligence. Now, take note. If on the test doesn't have negligence, then you can actually pick malpractice. Alright? But you have to remember this. Malpractice is usually used for doctors, professionals. Right? So, on the test, if it has negligence, and then right here it says malpractice, what will still be the answer? Negligence. Okay, because the only time you can pick malpractice is if there is no option for negligence. That is not there. Okay, because malpractice, again, is usually more used for professionals, like physicians. Okay, but if there's no negligence, you can actually pick. Is that clear, guys? Alright, awesome. Very good. Very good. caring for an adult client who is competent and has refused an analgesic injection. The nurse administers the injection despite the client's objection.
Battery.
Refuse to give you the injection. Alright, what will be the following type of sword? It is a
Battery.
battery. Okay. So remember, assault is verbal. So if I tell you, I'm gonna inject you if you actually leave, but I just said it, that's an assault. Okay, a lot of times, you see it in the movie, they confuse it, the term, right? When they use the term assault in the movie, it's like you actually hit them, right? In reality, assault means it's only verbal. It's something that you said. I'm gonna punch you, I'm gonna kick you, that's an assault. But if I kick you, or I really punch you, that's a what?
Battery.
Okay? So don't forget, the physical action is battery, and the verbal is
So.
assault. Okay, guys? Alright? Very good. Alright, there you go. It's the definition. Alright? Alright, we got the false imprisonment. All you need to do is read it, okay? The definition and memorize. Remember it. Okay. To the first one, the battery guy. There you go. Gonna upload it at the end once we're done.
Where may we upload it at?
Remind.
Okay.
It's gonna be in Remind, guys, okay? Alright, so here we go. Next one. This is gonna be another big one, guys. Restraint. There's actually 4 questions on restraint on your exit. So you gotta really, be aware of the things about restraint, okay? So the nurse is irrigating a client's abdominal wound. When the client becomes agitated, you have the bottle of the saline solution that the nurse is using to perform the irrigation and throws the bottle at the nurse. The nurse immediately calls for the UAP or for assistance. What action should the nurse take after the nursing assistant arrives? Tayo bro.
That's a good thing.
What do you think, class? A, B, C, or D? Letter D. Tie him up. I'm not joking, it's the real answer.
Oh.
I'm not joking.
Yeah. Oh yeah, you do the restraint before the prescription. Is there the danger to them?
Yeah. That doesn't require an assessment because they're just using it, And the licensed nurse is the one that does it. They're just tying it, okay? Now, here's the other thing. There's a question on performance evaluation. What is the best way to determine your UAP performance? What's the best way to evaluate?
Teach back.
Look for the word return.
Return demonstration.
Demonstration. Very good. Look for that. That's one of the best answer, okay? Return demonstration. Alright? Don't pick an answer that they tell you that A, they can tell you the steps. B, they can write down the steps. C, they can what do you call this? Write it down completely, and then D, they can return demonstration. So the answer is what? Return demonstration. The other thing, very important to know to remember, if you're going to evaluate the UAP performance, it's better to assign another UAP, but with more years of experience. Do not pick an answer that you will be the one following the UAP. Why? Because as an LVN or as an RN, if you follow the UAP, what happens?
You can't do LVN stuff.
You take away your responsibility of what? Giving medication, assessment, doing treatment. So who should be following the UAP to determine if they're doing it right? Another UAP, but with what? More years of experience. That's clear, guys. Don't forget those two things. Return demonstration and another UAP with more experience. Now, the question is, why tie him up? The answer is,
It's a danger to himself.
the patient is a danger to self and others. Always remember, if the patient is a danger to self and others, you don't need an order to immediately use a restraint. You can use a restraint without an order as long as you get the order within the first hour of applying the restraint. That's the rule. Okay? So you can apply the restraint as long as you get that order within that first hour of applying the restraint. That clear, guys? Alright? So in this situation, the patient is already throwing what? Bottles. That's a danger to us.
Yeah.
Okay, so you can already restrain it. If you fix C, stopping the wound irrigation and telling the client that she will complete the procedure when it calms down, that would be an incident report, because if your treatment has a time, then that means you didn't follow the time, right? Okay, just like medication. Medication has what? 1 hour before, 1 hour after. If you don't follow your treatment plan, then that would become a what? An incident report. Alright, so what do? You tell the UAP, tie up the patient, and I will monitor the patient until they can know the patient is ready for the treatment. Because they're a danger to others. Alright. Here's a different situation though. At 3 a.m., the nurse is making rounds. The nurse finds a client with Alzheimer's disease fighting over the side rail of the bed. Remember, they stand down. Right?
Oh.
The nurse rushes to the client and assists him back into bed. Which action should the nurse take first to ensure client safety?
Okay.
The answer is, the situation is safe. We want to do a what? One-to-one. That's a normal behavior of someone who has Alzheimer's, so that's not really a danger to us. Self and us. Alzheimer's have sundowning, that's their normal characteristic and behavior, but that's not an actual danger. Okay? So in this situation, we don't need to what? Use a restraint. Okay, so remember, there are two types of restraint, physical and chemical. The first option is use physical first, and the last option is chemical. Alright, so a few things to remember. How do we tie a restraint? What's the answer? They're going to be asking you that. How to tie a restraint?
On the frame of the
The
bed.
answer is, yes, I heard some of the answers.
Padding on the bony part.
So, if not, right, the other answer is quick release knot, and the other answer is single loop knot. Right, it's the same. So on the test, if you see any of those, they mean the same thing. Quick release. So it's slip knot, quick release, single loop knot, they're all the same thing. That's the right answer. How about if you see square knot? Would you pick that? How about a double knot?
What if they don't know where to attach it to?
Oh yes, they will be asking that too. So, that's my next question. Where do you attach it to? The bed frame, the bed rail, the headboard, the footboard, the bed frame. Right, now here's the thing though. On the test, they also describe that as part of the bed that moves. Right, so that's it. Don't forget that. Bed frame. Part of the bed that moves. Don't forget that they mean the same thing. So if they describe it as the part of the bed that moves with the patient, that means bed frame. Okay, so again, not the side rail, not the headboard, not the footboard, the bed frame. Alright? Okay? And remember, when you tie it, how many fingers should fit? Two. Not three, not one, two, right? You do an assessment in children every 15 to 30 minutes. For an adult, every 30 minutes to an hour. Right? You have to release the restraint also. At least every 1 to 2 hours. But when you release the restraint, you only release
one at a time.
one at a time. Okay? One at a time. Alright, so there's gonna be a question on this. And they will ask you, it's an important one, they will be asking you this. When you're doing a restraint assessment, we're gonna ask you what kind of assessment do you do on the restraint? The answer is
Circulation, neurovascular.
neurovascular assessment. Neurovascular assessment. Don't forget that, okay? Again, for children, every 15 to 30 minutes. For adults, every 30 minutes to an hour. Now the question is, give me some neurovascular assessment.
Caprico.
The pulse. Right? So the pulse is good when it is palpable, and it is bad if it is rapid, deep, and ready. That's bad, right? We want it to be palpable. We don't also want it bounding, because bounding could be fluid overdose, right? So we want it to be palpable. You can palpate it. But if it's rapid, weak, and ready, that's bad, because that could mean what? Poor circulation. Other than pulse, what else do we assess? Skin integrity, yeah, that's another thing. But something related more to neurovascular. But you're correct. You can
Capillary
you have to check skin integrity.
Caprico.
Other than LOC, something restrained. Because it's restrained, so it's localized, right? So it won't really affect LOC. Unless the restraint is right here, right? You don't put the restraint here, right? Okay. So if the restraint is here, what is another neurovascular check? Capillary refill.
Yay.
That's it, right? Capillary refill. So if it is good, if it is less than
3 seconds.
seconds. If it's bad, if it is greater than seconds. What else other than capillary refill?
Oh, yeah. Temperature.
Movement.
Oh, movement.
Right? We have to ask them what? If they can move, CMS, right? Movement and sensation. Can you move it? Can you feel it? Right? So there you go. Neurovascular check. Movement and sensation. Well, if they can't move it anymore, maybe that part of the body is gone, right? That's it. So movement and sensation. What else? Color.
Color.
Temperature. Right? The color should not be pallor, right? What does pallor mean?
Like pale.
Pallor means pale. So it shouldn't be pale, it should be pink, right? And the temperature should be
Warm.
Right. Good. And then the other one, which is related to the next thing that's gonna be on your exit, is compartment syndrome.
Yes.
So what is a classic manifestation of compartment syndrome that's
Paresthesia.
included in the neurovascular check? Pain. Very good. That's right.
Yeah, that one.
Pain. We assess for pain. It is not good if the pain is what? Sudden and severe, and it cannot be relieved by medication. Can no longer be relieved by medication. It's sudden and severe. That could be what? compartment symptoms. Yeah, and they're gonna need most likely surgery like fasciotomy. Right? It's probably gonna need that. Okay? So, we assess the pain. Okay, is that clear? Neurovascular check. Alright, very good. Okay, we get this. We do that, right? Alright. So when it comes to restraint, what is the least restrictive? If you're going to use a restraint, what would be the very first restraint you're going to use? You have either the hand mitten or the wrist restraint. Okay? You have the hand mitten or the wrist restraint. Other than that, the next one is the belt or the bed. Now remember though, the belt, you're going to ask the location, where should it be? Belt, not here, not here. Okay? Alright? You know, another thing that they will ask you on location, that's going to be on the test, it might also be a picture, is seatbelt. Okay, so make sure that if they're pregnant, the seatbelt should not be on the abdomen. It should be where? On the thigh, or on the lower abdominal area. Okay, it's another one that you might ask. Okay. So for this one, for a belt restraint, it's going to be on the hip or the waist area right here, and it is again tied on the frame. There you go. And for children, you actually have the elbow restraint. Okay. Right, and then for infants, you have the mummy. Alright, here we go. After this, one more topic and we're done for today, guys. So, let's take a look. This question says, a nursing student arrives at the clinical nursing unit and presents a plan of care for an assigned client to the nursing instructor. The assigned client requires the use of a mitten restraint because he has been pulling at his endotracheal tube. With intervention regarding the restraint in the plan of care requires revision. So we're looking for something that is what?
Wrong.
That is wrong. So, what's the technique in, select all the supply question? Ask yourself, true or false. So in this one, we're looking for all that is what? False. Right? So we're looking for false. We're not going to take the true, right? Because it's looking for revision. So, take a look. Okay, true or false? Letter A. Ensuring that the client restraint strap are attached to the bed frame. True or false?
True.
True. We're not gonna pick that, right? So A is not an answer. We're looking for revision. Okay. B. True or false? Making sure that one finger can be inserted under the restraint. False. So B is one of the answers, right? So B. We're looking for revision. True or false? Using a quick release tie to secure the restraint to the bed frame. True. We won't take that. Checking for a renewal of the physician's prescription for a restraint. True. When is the order renewed?
1 hour.
Every 24 hours. Okay. You have to renew it. If they don't renew it within 24 hours, you have to what? You have to remove the restraint. The same thing, if you put the restraint and you don't get an order within that hour, you have to what? Remove it. Okay. Right, next, true or false? Checking skin integrity and neurovascular check and cardiovascular status every 1 to 2 hours.
True.
False, because we said what? Every 15 to 30 or 30 minutes to an hour. That's too long, 2 hours.
Okay.
It's a long time. So false, so we're gonna pick what? E. We're gonna pick E, right? And that's false. Removing the restraint every 2 hours for 30 minutes to perform range of motion exercises. It's also false because it says restraint, and we only remove what? Because you have to do a reevaluation. So that's the nature. Because our goal, even if we apply the restraint, our goal is to remove. That's the goal. We will use it, but at the end of it all, our goal is to make sure we remove it also. The sooner we remove it, the better. So yeah, even with that situation, although doctors might get involved. All right, okay. Any questions? All right, so this is very easy. This one you just have to memorize. The way they ask this is they're gonna ask you a question on which member of the healthcare team you're gonna ask for referral. Right, so let me give you an example. You have a postpartum mom. The mother doesn't want to breastfeed, but they want a good alternative to breastfeeding. Right? Alternative to breastfeeding, something like that. The other one is you have someone who had a stroke. They're having a problem with using their hands for toothbrushing.
Occupational therapist.
Occupational therapist, right? How about for someone for walking? Physical therapist. How about someone for swallowing? Speech therapist or speech pathologist. How about you have a prescription that you cannot read because there is error on the order? Who do you ask for the clarification of the order of the prescription?
Provider that
Pharmacist,
or the doctor.
advanced care, nurse practice, respiratory therapist.
Pharmacist?
No MD. I didn't put MD. You know why? Because there's going to be a question without an MD. So the answer is advanced care nurse practitioner. Right? So other than the doctor, the only one who can really write prescription are your NP and PA. Pharmacists cannot write prescription. They only can what? They can only recommend, but they can't write prescription. Okay? Alright, is that clear, guys?
Yes.
Alright, then see you tomorrow. Don't forget, tomorrow we have our fundamentals, NGN practice test at the end of the class.